This is the Wrap on Aging, and I'm Rob Ench, your host with the Utah Commission on Aging. The Wrap on Aging informs and empowers Utah's older adults through research, education, and training, public policy advocacy, and connects you to vital services. Today's program is co-produced by Co-Imagine Health Utah and the Utah Post Registry Steering Committee. With me are Troy Wilson, an elder law attorney, and Dr. Cami Collette, a healthcare provider. Welcome, Cami and Troy.
Thank you.
Thank you, Rob. Glad to be here.
In this session, we're going to discuss advanced directives and POST agreements. In Utah, a POST is a provider order of life-sustaining treatment. Both of these documents reside under an umbrella concept called advanced care planning. What is advanced care planning and why is it important, Troy?
In a broad sense, advanced care planning is really just thinking through what your wishes would be if you come upon a crisis situation or if you can't make those decisions yourself. And usually when people talk about advanced care planning, they're going to talk about documents that we're going to discuss today. And in a specific sense, those are legal documents that can authorize somebody else to act on your behalf in case you don't or are not able to. And it's important because when you're in a crisis situation, it's very difficult to make decisions. And if you have somebody that you've already thought of beforehand to help you with those decisions, then you can also talk to them about what the decisions are you want made.
So, Kevin, what are some of the things that people need to think through when they prepare these documents?
So with the advanced directive, they are choosing a healthcare proxy or someone who's actually going to be making decisions for them if they are unconscious or unable to speak, if they've developed dementia and can no longer voice their opinion. They have to have the advanced care document done before they get the dementia because only if that person can fill it out. So the things that they need to keep in mind is the person who is the patient, in my situation, I need to know who I can legally talk to when that patient is unable to speak for themselves. And ideally, that person is supposed to follow what the patient wants, not what they want. So these are the important things when choosing healthcare proxies and who will be making decisions for you if you are unable to make a decision. That is the advanced directive, also known as a living will, that can designate a few other information as well.
So a lot of times people get concerned that they won't be able to choose for themselves and they don't want systems acting upon them. What are the kinds of things that you discuss with people in terms of determining their values and priorities for life?
For myself as a physician, when I'm dealing with people who are very seriously ill, and they are very concerned about ending up in a hospital and having feeding tubes putting down, I have a conversation with them concerning a different form, which is called a POST form, or a provider order for life-sustaining treatment. The provider order of life-sustaining treatment would outline if they do want CPR, if they do want a feeding tube, if they do want to have a certain types of treatment, or if they don't. And so I go over the POST form, and we can actually turn that into a medical order, which is a different form than the advanced directive. All my patients over 18, I want them to have an advanced directive so I know who I need to call in case that they are seriously ill and I cannot communicate with them.
So you posed some questions at one time in terms of where people draw their own line in the sand and what makes life worth living. You even referenced some things are worse than death. Say more about that.
Okay. So when people are trying to make that decision, there are some things that are worse than death. Some people actually would be fine with living with a feeding tube. They would be fine with dialysis. Some people would be fine with a short-term stint on a ventilator if they knew they were going to be able to get off. However, if someone was seriously injured and they had and they were unable to feed themselves, if they were unable to communicate or talk with their family, if they could not have the joy, what gives them joy in life. So when I'm going over the form of the POST form mainly, I first of all want to make sure they understand their illnesses, if they have hypertension, diabetes, and then I go over what their goals of care, what's important to them, what makes life worth living. And that is what helps me put the basis of then we can come to, and if you can't do that and your heart should stop and you're not breathing and you have died, would you want to be allowed to die a natural death? And that is what is termed DNR. We would not do CPR to try to resuscitate you. That is one portion of the pulse form. And then I talk with them too, if they're willing to have the feeding tube. And then also who I'm supposed to call and talk to. And then there's one other portion of that form of the pulse that says, do you want your family members to be able to change it? If you're unconscious and you are going to need a feeding tube, do you want your family members to be able to put a feeding tube down? And they can mark a box on the pulse form that says, no, I want this followed specifically. I want this as my directive. And once I sign it and the competent person finds it, that actually becomes a medical order that emergency medical people can follow, and hospitals can follow, and nursing homes and other facilities can follow, because it's a medical order, which is different than the advance directive.
Thank you. So Troy, what kind of counsel do you give folks when they are trying to decide where their priorities are? What is your advice?
Well, as a lawyer, we can't execute a pulse form. We can help clients execute the advance directive. And so what I talk to them about is some of those consequences or circumstances that Cami mentioned. For example, you can't recognize your friends, or you can only stay alive if you have a ventilator. What is their wish if that were to come to be? And this is not typically when they're ill, although it could be, as long as they still have capacity. This is typically just when they're an adult and they're thinking in advance what they would want if circumstances ever came to that. So I suggest anytime somebody's 18 years or older, if they're going off to college, they should have an advance directive. They should think through those issues and maybe talk to parents, maybe talk to children, and make sure that who they would designate as their agent is on board and understands what their wishes are. So it's important to try to think of different types of circumstances that they could find themselves in, and how would they want their agent to intervene on that and give direction to the physician.
So the advance directives and pulse agreements, both very important documents, but they serve very different purposes.
Mm-hmm.
So let's discuss a little bit more about what are those differences. Cami, why don't you lead off? We're actually putting a graphic on the screen that will help people walk through some of the differences between these two important items.
So the pulse form, it is actually for someone who is very seriously ill. If I would be surprised, if I wouldn't be surprised if this person might die in the next year, that is a person who very appropriate is for a pulse. For my 18-year-old kids going off to college, they don't need a pulse, but they definitely need an advance directive. And many people might not even realize they actually have an advance directive on their driver's license if it says D for donor. Or maybe they're a Jehovah's Witness and they don't want a blood transfusion and they carry around a card. That's a form of advanced, a simple advance directive. But the pulse form is a medical order. If you have a medical order that says you do not want CPR, and the emergency medical people find you, say the 90-year-old collapsed on a golf course, and he is unresponsive, he does not have a pulse, he is not breathing, and they can look up a pulse, or he has the pulse with him, the EMS is not obligated. Emergency medical, the ambulance are not obligated to do CPR. However, if it's just a living will, they are obligated to do CPR until they get to the hospital. And then the physicians at the hospital would make that determination if CPR should continue. And CPR is cardiopulmonary resuscitation. So that's the biggest difference between the pulsed and the advanced directive. The physician is in charge of writing out and filling out the pulsed. We keep records of it. We can scan it into your medical record. It can be scanned into the hospital. And I'm on a committee to try to get that available electronically so that the EMS en route can be able to access that like they do in Oregon and in the state of New York, where they have these forms electronically available to those people.
Troy, what other thoughts do you have about the differences between these two documents?
Well, I want to reinforce something that Cammie said, and that is that an advance directive is not a DNR. Sometimes I'll have clients come in and they say, I don't want to be resuscitated. Emergency medical services, when they show up, their protocol is to resuscitate. So unless they have a POLST form, which is a physician's order, a medical order, they have to resuscitate. An advance directive has two parts. It has an appointment of an agent and also a living will that says I don't want to be kept on life support if that's what the client chooses, but it is not a DNR. So the main difference is the advance directive you do in advance, and it's filled out and signed by the individual, the patient. A POLST is signed by the doctor after consulting with the patient, and typically it's signed at a time when they have a terminal or a very serious medical condition.
So let's just reprise a little bit, and thank you both for that deep information. Why is it important for individuals to have both documents? Troy?
I would say the primary importance is the advance directive for everybody, because you can do that at any age. And once you're an adult, that's important because you never know what is around the corner. If you get in an auto accident or you have a stroke and somebody has to make treatment decisions for you, then you are better off if you have a person that you've pre-authorized to make those decisions. The statutes have an order where a surrogate can step in, but it may not be your choice. By completing an advance directive ahead of time, you make your own choice. A POLST form is likely not going to be completed for somebody that's young and healthy and off to college. It's more likely to be completed for someone who's either got a serious illness or terminal condition and has been under the care and treatment of a physician.
So, Dr. Collette, you have probably witnessed circumstances where people don't have a document in place. Could you just describe quickly some of the consequences when decisions have to be made and you don't have these guiding documents?
Yes, this often occurs in an emergency room setting. We have a very ill patient, they're unconscious. We try to contact the closest relative, or maybe the closest relative comes in. Maybe it's their oldest granddaughter that brought grandma in. And of course they say, oh, put grandma on a ventilator, get grandma on a feeding tube. And we get them into the ICU, and then we find out they have a POLST form that says grandma never wanted to have a feeding tube. She never wanted to be on a ventilator. She wanted to be left and be kept comfortable and be allowed to die a natural death. And they actually have gone against her wishes. Once they're on the ventilator, sometimes they have to make the decision to take a person off. And this can be very heart-wrenching for an entire family. It can also be an area of battlegrounds. We cannot kill grandma. We cannot, and the family feuds that occur in the emergency room, in the hospital, in the ICU, it is not comfortable. If we have one person that is designated as their spokesperson who truly understands the wishes of that individual, we can honor their wishes, even though we have not in that emergency setting because we did not have access to the forms at the time of the emergency.
That's a really good point that you make, because one thing that we've talked about here is in terms of why you should have an advance directive for yourself. But don't forget, it's also a huge benefit to the family because there can be a lot of guilt associated with pulling the plug or making the wrong decision. But if the family is aware, either through a legal document or advanced conversations, of exactly what the patient's wishes are, it takes a huge burden off of that child who's making potentially a life or death decision for their parent.
And I think that these conversations are so much, it's a better conversation to have around the kitchen table than the ICU bed. If you can do it annually at Thanksgiving, Christmas, Easter, Whenever the family's getting together, maybe do review the forms, understand what people's wishes are, and then get the stories of the individual, why these things were important, why they love their family, so what they did when they were younger, why it's so important to them, why they have these lines in the sand that they would not want to live life in a nursing home dependent where they could not feed themselves, they could not talk with their relatives. And if you have those conversations around the kitchen table, that is so much better of a location.
Thank you both. Again, just briefly, will these documents be honored in other states? How does that work?
They should be, but one caution would be medical providers are used to seeing, and they're most familiar with their own state documents. And so while if you're traveling, you don't need to get a document made in every state you're going to pass through. Your document from your state of residence should be honored. But if you're moving your residence, it's a good idea to have new documents executed in your new state, because there may be different execution requirements, there may be different options. And also the medical providers, they're familiar with those. What you don't want to do is be in an emergency situation where a medical provider is looking at a form they're unfamiliar with and they send it up to their legal department for review. But Cami can probably comment on the practical side of that. That's always been my take on it.
Yes, and when I have a patient, we fill out a pulse form, we've got it signed, I make 10 copies. I tell them to give it to all the people that they think might come to the hospital and make sure they understand what you want. They have to keep a copy on their refrigerator, and if they could conveniently collapse in front of the refrigerator, that would be nice. It doesn't usually happen. But I do tell them to keep it in their glove compartment of the car, because the car often has, people are going to the hospital and they have those documents in the car. They can take it right into the hospital. When we go into hospitals, we're often asked, do you have a living will? And we often say no, and the next question is, and what's your insurance card? I mean, we really should be given a copy of the Utah Living Will and be able to fill it out while we're waiting the hours that we wait in hospitals and doctors' offices to be able to complete those forms. But I do make sure that people have copies. The pulse form, one copy is legal in all of Utah. If you move states, they may or may not honor it. So I have some patients that live part-time in Arizona, and I recommend that they kind of check into what is the Arizona requirements. I have one daughter who takes her mother always out to Massachusetts every summer. And so she has the forms now in Massachusetts. She's got a doctor in Massachusetts when they spend the summer there with her mother. And then when they come back here, they have the forms here. And we always are updating every year at annual wellness visits to make sure that these still are her wishes, because sometimes things can change. They can get sicker. They may be closer to death. And then we have other discussions to have.
Thanks, Troy and Cami. This completes our first segment of our discussion on advanced care planning documents.